Hi, welcome to the video series on StrokeHub Fact Sheets. This topic is on physiotherapy. Stroke may damage parts of the brain that control body movement and coordination. Physiotherapy helps you to regain as much strength, coordination, and flexibility as possible. Your physiotherapist will assess you and recommend a care plan based on your medical history and current problems to give you every chance of achieving a good recovery. A common question after stroke: how does stroke affect my movement? You may experience weakness or complete paralysis on one side of your body. This can make it difficult for you to use those limbs in your daily activities. You may also experience sensory disturbances in the limbs on the affected side. The affected limb can feel numb or have heavy sensation due to the weakness. This can affect your ability to coordinate movements. Occasionally, some people may experience a burning sensation or that of pins and needles, which can be uncomfortable or painful. You may have problems with your balance and maintaining an upright posture. Joints over affected site may be prone to injury. For instance, a strain on the ligaments or inflammation along the tendons can occur in the shoulder, knee, or ankle joints on the weaker side. The muscles over your affected side also may become stiff, which can limit your movement. Some people may develop muscle spasms or spasticity. So what is physiotherapy about? After a stroke, the brain cannot grow new cells to replace the damaged ones. Physiotherapy helps facilitate your brain's ability to reorganize itself to regain some of the functions that were lost through various techniques such as exercises, skills training, manipulation, or neuromuscular electrostimulation. Where applicable, a robotics-guided therapy approach may also be used. In the early stages after a stroke, your physiotherapist will focus on restoring your ability to move safely. Depending on your needs, physiotherapists will offer therapy to help strengthen and coordinate the movements in your limbs, advise you on how to position yourself when lying down or sitting. They can work with your carers or nurses to teach techniques on how to transfer yourself from your bed to a chair and vice versa, and help you to relearn walking tasks and motivate you to participate actively in your rehabilitation journey. They will also help to decide if any assistive aids, such as walking sticks, that will help to improve your walking, improve your endurance and higher balance skills that are needed especially for community mobility. They can also work together with the stroke care team, your carer, family, and friends to support your recovery. Physiotherapists also help prevent secondary complications such as muscle and joint stiffness and chest infections. For some people who have suffered a severe stroke, a full recovery may be less likely. In such instances, your physiotherapist would use assistive devices to teach you and your carers different ways of doing things to help you achieve your optimal level of independence in your activities of daily living. Where will I have therapy? The location of your therapy will depend on the stroke severity. It is important to talk to your stroke care team to find out which location would be most appropriate for your condition. So in the inpatient setting, physiotherapy starts as soon as you are admitted into a hospital. It involves exercises at the bedside, moving around in the ward, or in a specialized gym area. When medically stable, you may be transferred to a rehabilitation unit in the hospital or community hospital to continue your treatment. In the outpatient setting, upon discharge from the hospital, there are day rehabilitation centers or outpatient therapy gyms services in hospitals which offer a variety of programs to work on specific goals. There are home-based therapy as well. These are specialized community rehabilitation teams. This might be suitable for people who have difficulty in mobilizing out of their house or have certain functional goals that would benefit from training in a more contextualized environment like their home. You may wonder, how can my carer or family help? If possible, your carer or family members should attend the rehabilitation sessions with you. They can learn to assist you with the exercises and apply the rehabilitation techniques with you at home. If you are confined to the bed, your physiotherapist will teach your carers how to position yourself in different ways so as to maintain flexibility in your joints and to improve your posture and balance. The nurses will teach your carer and help to reposition you every 2 to 3 hours to prevent bed sores during the hospital stay. Here are some tips for recovery. Number 1. It is important to be as active as possible soon after a stroke. Next, you can practice the exercises suggested by the physiotherapist. Also, remember to exercise every day or at least 3 times per week to promote better recovery. Do involve and move your affected side as much as possible. Exercise on a routine basis at a regular time each day or as prescribed by the physiotherapist. Another tip, be patient and aim for long-term rather than immediate results. You can try new activities that will help in your recovery. And if you suffer from post-stroke fatigue, exercise can help, but it should be built up progressively in a gradual manner as tolerated. You can use a notebook to record down the progress. You may also join therapy programs in Singapore National Stroke Association, also known as SNSA, or the Stroke Support Station S3. How can I move about safely and reduce my risk of falling? If you need to use a walking aid to assist you with your walking task, then it is useful to take note of this safety advice. You should aim to improve or maintain strength in both legs. Repetitions of sit-to-stand exercise is a simple and effective way to maintain strength. Other methods for leg strengthening can be designed by your physiotherapist for your specific needs. Next, you should also maintain a good sense of your balance during standing. Regular practicing of suitable balancing exercises, which were taught by your physiotherapist, can help to fine-tune your balance. If you have just woken up from sleep, do sit up for a few minutes and then perform a few sit-to-stand movements at the bedside before walking away from your bed. If you are not feeling well or have just woken up from a sleep and need to start walking immediately, do ensure that someone walks with you. Installation of grab bars inside bathrooms and at entrances with curbs or steps will help to promote safety. And when walking outdoors, if the condition in your environment has become risky or has become different from your routine encounters, for example, wet floors, dim lights, a surge in pedestrian crowd, or walking into a crowded area, you can move at a slower pace and take shorter steps. If possible, have someone stand close to you as you proceed to walk. And you can also use appropriate walking aids as suggested by your physiotherapist. You can find more topics like this on StrokeHub at www.healthhub.sg/StrokeHub. It is a resource guide for stroke survivors and their caregivers. It is also available via the Health Hub app. Thanks for listening.